In Germany, we live with the feeling we are basically through. The numbers of newly infected people are very low, and we have half of our population fully vaccinated. So we might have a fourth wave of COVID-19 in the third trimester of 2021, but this wave will most likely be mild and short. This is our feeling, but the fact is that we do not really know where we stand. And this has basically to do with the fact that in most parts of this world, the pandemic is far from over. In countries like Argentina, Brazil, Mexico, South Africa, the numbers are still very high. And in most African countries, we do not really know the numbers of infected people because the number of tests are very low. We know nothing about which new virus variants are emerging in the new corona hotspots. And any variant that will emerge in any part of this globe will reach us sooner or later, and we do not know about the consequences. The Delta variant, for example, was first described in India and brought the infection figures up in European countries. In Latin America, now the Lambda variant is spreading, and we do not know what this will bring. Any of these variants might make vaccination less effective or, in the worst case, completely ineffective. Thus, not fighting the pandemic on a global scale from the beginning was not only unethical, but also short-sighted from our own interests. Yes, health experts have spoken already about these risks in the first months of 2020. Already in March of that year, the government of Costa Rica proposed to pool intellectual rights to technologies useful for the detection, prevention, control, and treatment of COVID-19. The WHO set up a patent pool in May of 2020. Had the international community responded positively to this initiative, it would have given us the time to build up high-quality production capacities in the global south. And before the cases skyrocketed in countries like India, South Africa, Argentina, we might have a much brighter picture today. In the short run, we think we have to support the global COVAX initiative and increase the financial support to COVAX from Germany and Europe. We see it as the most effective way to ensure that a larger quantity of vaccines will arrive to developing countries in the short term. As a medium-term measure, we support the Team Europe initiative that was launched at the Global Health Summit in May 2021. This initiative plans to mobilize 1 billion euros to increase the supply of the vaccines, basically by establishing regional production facilities in priority countries of Africa. In the longer term, we recommend to establish a system of global pandemic centers of excellence on all continents, because it's not only Africa that lacks capacities to deal with pandemics. The same is true for large parts of South and Southeast Asia and Latin America. So these global pandemic centers of excellence could be established on all continents. What would be their functions? We see several functions that these centers could fulfill. First, research and development on new pathogens, but also on the so-called neglected diseases, such as dengue fever, etc. Second, production of vaccines and drugs at an early stage when the market is not yet functioning. Third, capacity building to national organizations. And fourth, related services to national institutions. Services such as DNA sequencing of new pathogens that national institutions will not be able to provide. The institutional role model could be the 15 internationally financed agricultural research centers of the CGIAR system. CGIAR research centers provide important research for agricultural development, especially in developing countries. So this might be an interesting model to follow in the pandemic competence centers we propose. Establishing such a system of pandemic competence centers would require funding, but we consider that financial expenses that would be required are insignificant compared to the huge losses of human lives that a pandemic like COVID-19 implies.